Penguin Random House Audio presents The Nature Cure, A Doctor's Guide to the Science of Natural Medicine by Andreas Michalsen, M.D., with Petra Torbritz. Read for you by Kaleo Griffith. Forward by Walter Longo, Ph.D. For hundreds of years, health has been managed on one hand by official medicine based on the teachings of medical schools at the most important universities, on the results of clinical studies, and on the decisions of government agencies. On the other hand, health has also been managed by complementary medicine, sometimes based on ancient traditions, sometimes of dubious origin. In The Nature Cure, Dr. Andreas Michalsen combines the teachings of official medicine and science-based complementary medicine to help readers live healthier while minimizing the need for medication. Dr. Michalsen starts with the story of his personal journey to naturopathic medicine and then comes to discuss a variety of naturopathic therapies, ranging from the use of leeches, hydrotherapy, yoga, exercise, diet and fasting, and how they can prevent and even cure major diseases. Dr. Michalsen, head of the naturopathy department at the Emanuel Hospital and Charité Medical University in Berlin, is one of the best doctors of natural medicine I have ever known. His therapies are based on solid scientific and clinical pillars. In the field of therapeutic fasting, his clinic in Berlin is among the most prestigious in the world and is at the forefront of experimentation and implementation of new scientific discoveries on patients with diseases ranging from hypertension, diabetes, and cancer to multiple sclerosis. This is a book that brings us toward a new approach to medicine, a book that is not to be missed. Introduction. Fasting, yoga, Ayurveda, herbal medicine, meditation, mindfulness, a vegetarian diet. The subjects of naturopathy are more topical than ever before. But it's difficult to find scientifically founded guidance on naturopathy. Some things that have long been recommended in the world of natural medicine should be questioned critically. On the other hand, effective methods of naturopathy are often too quickly dismissed by conventional physicians. Yet it's become increasingly clear that many people are interested in exploring naturopathy and integrative medicine. It is high time, then, for an evaluation that takes experience, practice, and research into consideration in equal measure. Medicine needs naturopathy, now more urgently than ever before. An increasing number of chronic diseases is becoming widespread, and conventional medicine's method of treating these illnesses in the same highly technologized manner as emergency cases, with surgeries, interventions, and new medications, leads to more and more side effects and unaffordable costs. The traditional treatment methods of naturopathy have kept people alive throughout the centuries and have addressed various illnesses with astonishing efficacy, even though the methods were based solely on practical experience. Then modern medicine came along with its scientific approach and its extraordinary possibilities for diagnosis and therapy, and a lot of ancient knowledge was left by the wayside because it was considered outdated or even wrong. Yet today, the latest research methods of modern biology and medicine show that naturopathy is not a thing of the past, but highly relevant. In the crisis of medicine we're now facing, with its increasing costs and rising proportion of chronic illness, naturopathy offers solutions, showing us new ways of preventing and treating diseases. The central focus is not on the illness, but on the individual. As professor of clinical naturopathy at the Charité Berlin, the largest university hospital in Europe, with about 3,000 inpatient beds and more than 12,000 health professionals and scientists working there, I hope to share the enormous potential of naturopathy with the public and to close the gaps that continually seem to open between high-tech medicine and practical knowledge. At the Charité, our focus is not on setting divisions between different ways of medical practice, but on integration and combination on a scientific basis. Employing this concept, we treat thousands of patients to great success every year. My journey to naturopathy. I was born in a small village in the southern part of Germany, on the border of Austria and Switzerland near the Alps. My father and grandfather were both MDs who specialized in internal medicine. As a child, listening to my father talk about his workday at the dinner table, I realized that there was something special about his medical practice. Following in the tradition of my grandfather, my father treated his patients not only with conventional medication and surgery, but also with naturopathic and integrative medicine. He often advised lifestyle and diet changes for his patients, such as fasting or reducing stress. He didn't just prescribe conventional drugs, but also herbs and supplements. Growing up, I was accustomed to seeing his patients stop by our home to express their gratitude and sometimes to drop off a present, usually something nice to eat. On the other hand, I also grew up hearing my father talk about the suspicion with which his colleagues regarded his approach to medicine. My two siblings and I grew up in a loving home, surrounded by the principles of naturopathy. Our home had hot tubs and a Finnish sauna. My father would take cold baths in the swimming pool in our garden, even during the freezing German winters. We were encouraged to eat vegetables, fruit, and nuts, to drink herbal tea when suffering from a cold. So naturally, this felt like the norm to me, the way medicine should be. After graduating from high school, I decided to study economics and philosophy. Trying to understand the grand scheme of things has never ceased to fascinate me. But unlike other disciplines, medicine seems to be something that puts theory into practice directly, entirely hands-on. And like many young people, I wanted to find a calling that would allow me to help others. Or maybe it was just the family tradition that had me firmly in its grasp. In any case, I kept finding myself in biology lectures and realized that I felt much more comfortable there. So, it was to be medicine after all. Back in the 80s, when I was studying, the worldview of scientists was extremely mechanistic. For example, in one of the weekly sessions that were part of my training as an internist, I remember introducing a study exploring how psychological stress could cause a heart attack. As a result, I was ridiculed. "How do you imagine that would happen, Michalsen?" I was asked with pointed derision. Like, would anger spontaneously create a blood clot? Yet since then, countless studies have proven that anger and fear actually do constrict the arteries, which can cause blood coagulation and the dangerous blood clots that form the basis of a heart attack. When I was training to be a doctor, eminence-based medicine was in the process of transforming into evidence-based medicine. Just before, the demigod doctor, the eminence, was able to do whatever he thought was right. But suddenly, he was required to prove that his therapies were effective by conducting studies and through properly and systematically documented clinical practice. Evidence-based medicine introduced more rationality into medical practice, but it also began to ignore very simple knowledge and wisdom that wasn't supported by existing studies. Knowledge such as the fact that people fall asleep better when their feet are warm rather than cold. Later, it also became clear that research is conducted mainly where there is a return on investment. Patentable drugs, in other words. There is little money to be earned from hot foot baths, and it's accordingly difficult to obtain research funding for it. My superior at the time, Walter Timme, MD, however, was always open to new findings. He was a very experienced and science-oriented professor who turned each patient's course of treatment into an exam during rounds. In addition, he was the editor of the pharmaceutical magazine Der Arzneimittelbrief, and it was he who taught me that chronically ill patients take far too many drugs, and that it's always obligatory to examine what benefit each and every pill actually has for the patient. We had very constructive arguments, and he would say, "Why don't you write an article about?" That way I learned to describe the effect of medicinal plants or the importance of nutrition. On the occasion of his retirement in 2001, he asked me to give a grand round lecture about complementary medicine in cardiology. Those were very positive experiences I had in dialogue with.
Sample complete. Ready to continue?